Hello, my name is Dr. Burcu Saygan Karamursel. Today I'm going to try to give brief information about fibroids and their treatment. Fibroids are benign masses that originate from the uterine muscle. They may give no symptoms at all, or patients may have symptoms such as abnormal bleeding, pain, or pressure on the abdominal organs, for example, bladder, which may lead to frequent urination. In patients having no symptoms, the fibroids do not need any treatment, but we just follow them up by routine pelvic examinations and ultrasonography. However, in some patients who have symptoms, fibroids may need treatment. The treatment may be medical. However, medicines, which are hormonal in origin, will only temporarily control the symptoms of fibroids, but the fibroids will not go away. Therefore, surgery may be necessary for some patients. During surgery, we usually try to remove the fibroids only, especially in those patients who wish to preserve their fertility. Rarely, a hysterectomy may be necessary for fibroids because when the patient is young and there are many fibroids, she will have a higher chance of recurrence of fibroids even when they are removed. But patients approaching menopause have lower chance that the fibroids will recur. Also, we may see some shrinkage in the size of fibroids during menopause. For surgery, there are different techniques. An abdominal myomectomy is when we make a small cut in the lower tummy, which is called a bikini cut, and we remove the fibroids through this incision. And then we repair the uterus and close this incision. This procedure needs general anesthesia. The patients may stay 1 or 2 nights at the hospital, and they will need 4 to 6 weeks after surgery to recover. It is also possible to make a laparoscopic myomectomy, which is a keyhole surgery. In this surgery, we make small cuts on the tummy, which are 0.5 to 1 centimeters in size. Then we insert several long instruments through these cuts, which are used to remove the fibroid. First, we fill in the cavity with carbon dioxide gas. Then, after removing the fibroids, we repair the uterus and close these small cuts on the tummy. This procedure also needs general anesthesia, and the patient may stay 1 night at the hospital most of the time. She will need shorter recovery time compared to an abdominal hysterectomy, which is around 2 to 4 weeks after surgery. There is another closed surgery which is possible, and it is known as hysteroscopic myomectomy. This may only be done for fibroids which are located in the uterine cavity, which means they grow from the inner uterine walls into the uterine cavity. This cannot be done for fibroids which are located in the uterine muscles. This is also a non-invasive surgery where we insert a hysteroscope through the cervix. A hysteroscope is basically a camera, and we can also insert several instruments through the hysteroscope to shave off the fibroids within the cavity. There will be no cuts made, and most of the time we give general anesthesia to our patients. This can mostly be done as an outpatient procedure, which means the patient does not have to stay at the hospital after surgery, but may stay just a few hours for observation. It will take her very short time to recover, just about 2 to 4 days after surgery. I tried to give some brief information about fibroids and their treatment. If you have further questions, please do not hesitate to ask them in the comments section below. Have a nice day.